Hello everyone! Welcome to our investigation of transcranial magnetic stimulation and its incredible potential in treating depression. Come along with us as we explore the amazing world of TMS and find out how this new therapy is changing the way we treat depression. Let's start with the basics. What is TMS? Transcranial magnetic stimulation, or TMS for short, is a type of therapy used to help people with depression and other mental issues. TMS is used when more common therapies such as talk therapy or medication are not successful. It is a non-invasive neurostimulation technique which uses magnetic fields to regulate brain activity. So now that we know what TMS is, let's talk about how it works to treat depression. Imagine your brain as a complex network of electrical circuits. In people with depression or other mental health conditions, some of these circuits might not be working correctly, leading to symptoms like sadness, fatigue, and difficulty concentrating. To treat these symptoms, a special device is placed on the specific areas of the brain that control mood, and magnetic pulses are sent to give those malfunctioning circuits a gentle wake-up call. These magnetic pulses act like tiny magnets, simulating the neurons in those areas. It's kind of like pressing a reset button on a malfunctioning circuit. It helps the brain to reorganize and function more effectively. Over time, repeated sessions of TMS can help strengthen these neural pathways, leading to improvements in mood and overall well-being. Let's move on to how a TMS session is conducted. The procedure would look something like this. The patient will sit down at the TMS technician's office, ensuring to remove all magnetic items like jewelries and belts, and the technician will maneuver the TMS treatment device above the patient's head. The device is basically a coil that will release magnetic waves once it has been initialized by the tech. Once the device is positioned, the technician will use short TMS pulses to take measurements and test the patient's motor threshold, which is how much energy is needed to cause a thumb twitch. This allows them to determine how much energy is required for that patient's specific treatment in order to stimulate nerve cells in their brain. Once they have these measurements, they will initialize the TMS device and place it above the targeted area to begin the treatment. During the process, the patient remains awake. They will hear a loud clicking noise, so they will wear earplugs to protect their hearing, and they will feel a tapping on their scalp where the device is. TMS treatment sessions typically last around 20 to 60 minutes and are done 5 days a week over the span of 4 to 6 weeks, depending on the patient. Moving on, let's talk about the benefits of TMS. The biggest one is that it is non-invasive, because it is not a surgical procedure and does not involve any kind of anesthetic for numbing. The common side effects are usually mild and don't last long, and it can be done at the same time as other treatments. TMS is a highly effective treatment, with multiple studies finding that after the repeated sessions were over, patients showed significant reductions in their symptoms. Let's move on to the side effects of TMS. So some individuals may experience side effects, although many of them tend to improve shortly after the session and with continued treatment. Common side effects include scalp discomfort, pain, headaches, facial muscle spasms or tingling sensation, and occasionally feeling lightheaded. Some uncommon side effects, while rare, may include seizures, hearing loss, and emotional highs, particularly noted in individuals with bipolar disorder. It is worth noting that the risk of hearing loss can be mitigated with the use of ear protection during TMS sessions. When considering treatment options for depression, it's important to recognize that TMS offers unique benefits compared to other modalities, but it is not necessarily deemed to be better. TMS is valued for its non-invasive nature, sparing individuals from the need for surgery or anesthesia, and notably, it doesn't result in memory loss, unlike electroconvulsive therapy. However, treatment approaches vary depending on the underlying cause of depression. In addition to TMS, 2 primary categories of treatment include medication and psychotherapy. Medications such as SSRIs and SNRIs and more are commonly prescribed. These pills help regulate mood by working to keep neurotransmitters at the nerve snap longer, which helps with mood regulation. Each medication type comes with its own set of side effects that individuals should be aware of. Alternatively, psychotherapy offers a non-invasive approach where patients engage in discussions with mental health professionals to address their concerns. However, talk therapy relies on accountability from patients to adjust to challenging situations and working on replacing negative thought patterns and behaviors with positive ones, which can be difficult for some. In summary, the landscape of depression treatment is diverse, with various options available, each carrying its own levels of invasiveness. The choice of treatment ultimately depends on the individual's preferences, severity of symptoms, and response to previous interventions, highlighting the importance of personalized care in managing depression effectively. Let's talk about the cost of TMS, which varies by location, the number of sessions required, and additional services provided. Generally, TMS therapy tends to be more expensive compared to other forms of treatment for conditions like depression. It's essential for individuals to reach out to their insurance providers to understand the extent of coverage, potential co-payments, and any out-of-pocket expenses. Without insurance coverage, the cost of TMS can be a significant financial factor. TMS is generally considered a higher cost treatment. Individuals may need to bear the full financial responsibility. In such cases, healthcare providers offering TMS often collaborate with patients to explore financing options, payment plans, or potential discounts to alleviate the financial burden. Insurance coverage is determined by the specific policy and the reasoning for seeking TMS. While there are rare situations where insurance may cover TMS for specific psychiatric illnesses after other therapies have failed, in many cases, insurance does not cover the entire cost. For those watching our video, if you're interested in learning more about TMS, I recommend reaching out to mental health professionals or healthcare experts. Seeking advice from these professionals can provide valuable insights and help you better understand the potential benefits of TMS in treating depression. Awareness is key, and your informed curiosity can contribute to a broader understanding of mental health options. Don't forget to subscribe to our channel for insightful content on mental health and well-being. If you found this video helpful, give it a thumbs up, share it with others who might benefit. Let's spread awareness and support each other on the journey.